measured by what we do in terms of great care for patients, great science to make the next generation of discoveries that will affect patients, but also how we influence early detection of cancer and how we change the population, the community, the individual in terms of their seeking prevention care or getting the early detection modalities. So it really is part of our DNA, as it were, as a university-based public comprehensive cancer center.
Well, community colleges are in every county here in North Carolina. They have amazing reach throughout the state at the community level, the employees that work there, and the students who attend.
Well, we're the third largest community college system in the United States. We have 58 colleges. We have 850,000 or more students a year. We reach 1 out of every 8 adults in North Carolina on an annual basis. So we have quite a reach, particularly compared to other community college systems in the United States.
It serves as a place where if we could put a great program in, we would be doing it across the rural and urban areas of our state.
We were very pleased to have pilot planning dollars to actually explore the idea of partnering with the community colleges to promote health and cancer prevention here in North Carolina. The UCRF funds were critically important to our being able to do this work. They were essential.
The healthier our folks are, the less healthcare costs and the more time and work we have from our folks who are there. And so there's economic reasons, there's community reasons. We can build on quality of life, but if you don't have your health, you don't have quality of life. And so I don't know how we can talk about that quality of life mission without being focused on health.
So the pilot dollars were used to do a survey of presidents. We asked them about their ideas about what kinds of health promotion programs might be of interest to them, might be of interest to their staff, faculty, students, and even community residents. What we found is that the community colleges not only were very interested in this idea, obviously a 100% response rate was a good indication of their interest in promoting health, but we also learned that while there were some programs being offered in the community colleges, they were not what we would consider comprehensive programs. And comprehensive health promotion programs are the kinds that really have an effect on health long term, such as increased productivity, reduced healthcare costs, and just benefits to their general health.
We started examining what do we do, and we realized we didn't quite do enough.
Looking at the things that we know influence a person's risk of getting cancer: not eating right, not having enough physical activity, gaining too much weight, stopping smoking. Those are things which we feel if we could change, we could prevent cancer at its root. People wouldn't get it.
We know that a lot of the leaders understand the importance of prevention and how that can have a good impact on their employees' productivity, their health, their turnover, their absenteeism, and so on. But they need some help in actually making it happen. In each of these community colleges, first we're going to mobilize the employee wellness committees. If we get them involved in these programs, we know we'll be more effective. Second, we'll develop a wellness action plan. What that includes is programs that work, policies that have been shown to be effective, and environmental supports that will support individual behavior change at each of these sites. Once the Wellness Action Plan is together, we'll be evaluating the success of those programs. They'll be able to continue to improve programs and actually sustain these programs over time.
We've tried to promote health from pedometers to a fitness room to walking trail to healthy choices at our cafeteria and our vending machines. So we know that vending is going to be a reality on a college campus, but it doesn't all have to be honey buns.
If you were going to raise the health of a community, there's no better place than community colleges in my mind.
UNC, you made us look inward. So we weren't doing this before. You know, we were talking about things, but you organized us. You gave us a reason, a purpose.
I think research tells us what is most important.
I often tell people community college, community is our middle name. like to think where we work is a community too, and a healthy community, and that we are a microcosm of our neighbors, and we need to model what we want our students to be. If a little small school in Eastern North Carolina can do it, then any school in the community college system can do it.
You know, we actually want to thank the community college system for partnering with us in this. We think it's of great mutual benefit.